في الخير جايين. 100 مليون صحة، 100 مليون غالي، تأمين صحي يطمني على أهلي وعيالي. 100 مليون صحة، 100 مليون غالي، تأمين صحي يطمني على أهلي وعيالي. وبدأنا محافظة ورا محافظة، تأمين صحي في كل محافظة. مصر عليك في الصحة محافظة، صحتنا دواء، مصر بتتغير في الصحة. تأمين شامل ليك عالصحة، ده احنا يهمنا تبقى الصحة من الألف للياء. 100 مليون صحة، 100 مليون غالي، تأمين صحي يطمني على أهلي وعيالي.
The World Health Organization considered the 100 Million Health Initiative as unprecedented. Egypt has hosted since the mid-20th century the headquarters of the WHO Regional Office, which supports health activities of more than 500 million citizens in 22 countries in the Eastern Mediterranean. Since then, Egypt and the WHO has been cooperating to eradicate the hepatitis C virus in Egypt within the framework of the 100 Million Health Initiative, which the World Health Organization considered an unprecedented initiative in terms of its massive scope, quality, and speed of implementation. The umbrella of services of this pioneering initiative extended to include many African and Asian countries as part of Egypt's efforts to activate its role and responsibility towards the international community. These efforts represent a clear example of the deep belief in the importance of health solidarity and full commitment to promoting and protecting public health, along with supporting the fundamental principles of equality and justice, which help achieve sustainable health security for all humanity. Egypt has great interest in developing the health field through the initiatives of President Abdel Fattah el-Sisi, and one of these initiatives that proved its success is the initiative of treating some diseases such as hepatitis C virus, diabetes, blood pressure, and obesity. The prevalence rate of the C virus in 2018 was 7%, then it declined to less than 2% in 2020. Within a year, every adult aged over 18 years underwent screening, and those positive for HCV were mandated to get state-funded care within 7 months as part of the initiative that aimed at the elimination of virus C and early detection of non-communicable diseases. Egypt is on its way to obtaining international certification for being the first country in the world that is free of the hepatitis C virus, after it was one of the highest countries in the world in the outspread of the C virus among its citizens.
نازل خبط انت على المنازل في العمارة وانت نازل خبط انت على المنازل واللي يقول لك لا مش نازل قول له انا خايف عليك.
The President's initiative to eliminate HCV was launched in October 2018 through a national campaign for the early detection of hepatitis C virus infection and non-communicable diseases, diabetes, high blood pressure, and obesity, and presenting evaluation and treatment service through treatment centers. Under the 100 Million Health Initiative, 70 million Egyptian citizens received medical services, and medical screening was conducted for 50 million Egyptians as part of the early detection of non-communicable diseases and treatment for 1.8 million diabetic citizens and 10 million hypertensive patients, while 19% of citizens with high blood pressure who had no history of the disease were detected. Presidential initiatives included putting an end to the waiting lists for critical and urgent cases, as the waiting rate for surgeries in 2018 was 3 months, during which 9 surgical interventions were performed. Then it fell down to only 1 week in 2020, during which 11 surgeries were performed for patients. As for the total cost of the initiative for the elimination of virus C and early detection of non-communicable diseases, it amounted to about £4 billion, including £2.5 billion for the cost of screening and £1.5 billion for the cost of treatment. The initiative contributed to freeing the country from bearing the brunt of treating the C virus and its complications, which reach £64 billion annually, through early detection and treatment of the disease. The campaign also succeeded in early detection of diabetes, high blood pressure, and obesity, and directing the patients to receive treatment in various units and hospitals of the country. President Abdel Fattah el-Sisi's initiative to eliminate the virus and detect non-communicable diseases under the slogan 100 Million Health is considered a national campaign, as it succeeded in treating 2.2 million patients with hepatitis C, which certainly led to the decrease in infection rate. It is worth mentioning that the high-level global dialogue organized by the World Health Organization, which synchronized with the World Hepatitis Day on July 28, was attended by a number of health officials and international organizations to review and share the successful experiences of countries in eradicating the C virus and discuss ways to accelerate its total elimination by 2030.
أنا ما
Under the directives of President Abdel Fattah al-Sisi, the Egyptian government has put the health sector at the top of its priorities, which in turn contributed to strengthening the health system, stressing on the importance of sharing and exchanging the experiences of health systems around the world to achieve the goal of eliminating hepatitis C by 2030. Egypt was one of the countries that suffered the most for many years from hepatitis C, which was reflected negatively on the health, social, and economic levels. Egypt is now a leading country in the field of public health care and the elimination of hepatitis, as the World Health Organization is on its way to declare Egypt as the first country free of hepatitis C. The WHO and the World Bank, in addition to the sustainable partners from international organizations, private sector and civil society, play an important role in giving support to Egypt during the initiative that aims at eliminating the disease in Egypt. However, the main factor for the success of the initiative is the permanent coordination and cooperation between state institutions to support the health sector in Egypt to face all challenges, especially during the coronavirus pandemic. HIV testing was carried out as part of the initiative using the hepatitis C rapid diagnostic test as directed by the World Health Organization, and immediately transferring patients to treatment units, confirming Egypt's ability to locally manufacture hepatitis C drugs at competitive prices compared to the global price. Meanwhile, the Ministry of Health is keen on raising the efficiency of the medical teams serving the initiative through continuous training courses, the development of research capabilities, and data collection. The laboratories where tests were conducted for the C virus have also been expanded, which contributed to Egypt's possession of an expanded PCR laboratory network during the response to the coronavirus.
بلدنا وهنطمن على صحتنا. تأمين صحي جاي لراحتنا وقد الأحلام. يا سلام على مصر وعلى ناسها والصحة ايدك على راسها. جيشها الأبيض دول حراسها لسنين قدام. 100 مليون صحة 100 مليون غالي. تأمين صحي طمني على أهلي وعيالي.
The coronavirus pandemic reflected the solidarity, cooperation, and rapid response among the countries to protect health systems, which indicates the importance of continued cooperation between states in order to eliminate hepatitis C. Egypt showed readiness on sharing the knowledge and experiences gained during the elimination of the C virus with all countries. President Sisi ordered intensifying efforts aimed to transfer Egypt's health and medical expertise to other African countries for curing 1 million Africans, and WHO announced its support to Egypt's effort to eliminate hepatitis C among Africans via holding inter-regional consultations and via cooperation among the WHO offices across the continent. In a related context, under the presidential initiative to shorten the waiting list for state-funded surgeries, 334,339 operations were carried out, including catheter operations, heart surgeries, brain and nerve surgeries, orthopedics, oncological surgeries, and vascular surgeries. In order to support the health of the Egyptian women, the initiative is designed to screen carcinoma of the breast at an early stage for 28 million women, governorate-wide, and spread health awareness of risk factors, symptoms, early signs, prevention, methods of early detection of common tumors in women. In the same vein, reproductive health, family planning, and healthy lifestyles remain at the core of the initiative. The initiative aims at reducing the death rate resulting from breast cancer through early detection of the disease. 70% of breast cancer cases can be discovered in the 3rd and 4th stages, both by breast self-examination and periodic clinical examination in healthcare units. The initiative also aims to train and qualify the program's workforce in order to provide quality services according to international standards. It also works on improving the infrastructure for oncology centers in Egypt in order to achieve a comprehensive health insurance system.
عشان بكرة تربى عيالك الشفاء بقى بين ايديك وانت ماشي في اي حتة ماشي في اي حي هسمع التلاتة ستة في ايدك وانت جاي ماشي في اي حتة ماشي في اي حي هسمع التلاتة ستة في ايدك وانت جاي من عمارة وانت نازل خبط انت على المنازل من عمارة وانت نازل خبط انت على المنازل واللي يقول لك لا مش نازل قول له انا خايف عليك.
This initiative has been implemented through several axes. unifying the working system of women's health centers and oncology centers, applying a standard protocol for the diagnosis and treatment of breast cancer, and continuous follow-up on patients to know the results and effectiveness of the treatment lines used and/or the need for other diagnostic means or additional therapeutic methods. It also includes creating electronic networks and automated health units linked to a central system. New initiatives have also been implemented, including the President's initiative to detect and treat kidney diseases. About 6.5 million citizens had been screened within the framework of a national campaign for the early detection of kidney disease, which is part of the 100 million health initiative. Primary care units were also set up under the initiative to detect and cure chronic diseases and kidney disorders, in addition to offering high-quality health services for all the citizens in all governorates. Under the umbrella of the 100 Million Health Presidential Initiative, the Mother and Fetus Health Initiative was launched to diagnose diseases transmitted from mothers to fetuses at an early stage and provide free treatment and medical care for those that require it. Along with the checkups during pregnancy, the initiative includes a follow-up on mothers and their newborns for 42 days after delivery to detect any health complications, should they arise, as well as dispensing the necessary micronutrients during that period. The wide umbrella of services of this pioneering presidential initiative, 100 Million Health Initiative, which the WHO considered as unprecedented, bore fruitful results that are among the most important at the health level in Egypt.